Okay, that's the crowd.
Hi, my name is Allie Nichols, and I will be doing a speech on organ donation. On my license, there is a heart, a little red heart on the bottom right corner. That heart means that when something happens to me and I pass away, I want my organs to go to somebody else. The same heart that you see on my license is one that was on a 20-year-old male who saved my grandfather's life. Now, when my grandfather was in his 60s, he was waiting in the hospital for a heart to become available. Because of someone saying, yes, I would like to be an organ donor, he has now been able to see 5 grandchildren grow up. 4 graduate from high school, 2 graduate from college, and 2 get married. Saying yes to being an organ donor may seem small when you first get your license, but it means saving somebody else's life. Today I would like to inform you on patients that are on the organ patient waiting for their organs list today, the life years that can be added to someone else's lives by being an organ donor, and what you can do to become an organ donor. In 2013, there was over 121,000 patients on the waiting list. So they had to wait for someone who had the same blood type as them, had available organs that they needed. But there is less than 15,000 registered organ donors. A person is added to the patient list every 10 minutes. So by the end of an hour, 6 patients will be added to the patient list. The average number of deaths per day is 18 patients. The reason for this is because they have to wait for someone who has the same blood type as them and can find an organ that they need. Organs that are donated by a person between the ages of 18 and 40 are the most usable. All organs except for the pancreas can be used. So your heart, your lungs, your tissue, your eyes, it can all be used to add years to someone else's lives. And the pancreas, they're working on ways, they're finding ways to use the pancreas today. In 2002, a donor between the ages of 18 and 40 could add about 41.4 years of life to someone's life. There are 2 ways to become an organ donor. The first one is by first-person consent, which means you have documentation of your wishes for your organs. This is what most states use. Most states only use first person. So you can do this by saying at the DMV that you want to be an organ donor and having the little heart put on your license when it's printed. You can have it in your will, saying that when you pass away you want your organs to be donated, or you can even do advance directive, which says, when I pass away, I want my organs to be harvested and I want it to happen so that the most lives can be saved. The second is family consent. Not all states use family consent because it's not always what the patient would want. But what this means is that when you pass away, your family gets to decide if you donate your organs or not. You can tell your family what you want, and they can tell the doctor he wants to be an organ donor. So it's important that you go ahead and take care of this as soon as possible because you never know. The unexpected can happen, and you want to make sure that if you want to save these lives, you let someone know. You can save lives by simply saying, yes, I want to be an organ donor when getting your license at the DMV. It's as simple as checking a box. So today we have learned that there are more patients waiting on the organ waiting list than there are actually registered donors. We have learned that someone between the ages of 18 and 40 can add 41 years of life to people. And then it's very simple to become an organ donor. It's just telling people and saying, I want to become an organ donor. By agreeing to being an organ donor, you are saying that you want to save lives when the unexpected happens to you. It is also important that each individual takes the time to make their first person consent to make sure that they have informed everybody on what they want when they pass away. Thank you.
on the second floor.
How much?